Hello, this is Mary Lou. Welcome to the ARCIS training class. On this video, I'm going to show you two applications that are very useful in the intensive care unit. It will be the bedside numbers / assessment tab and the CCU IV intake / lines and tubes tabs. So these two tabs will appear only on the critical care desktops. Let's start off with the bedside numbers / assessment. So after you click this, 4 screens will show. On the left upper screen is your bedside number documentation. And after you do your documentation, your vital signs will populate on the bedside numbers grid. On the reassessment documentation, which is this screen, after you enter all your documentations, it will populate to the assessment grid screen. So now let me show you how it works. Let's launch your bedside number screen and you click OK. And this is how you start your documentation. But before we go further, let me first explain under the patient shortcuts, we have an application called Device Connect. This Device Connect application is going to interface all your vitals from the ICU monitor to the bedside numbers. However, today I'm going to show you how to manually put in your vitals on the bedside numbers documentation. So let's start with the temperature. So it says under your transaction line, enter temperature. So I'm going to put in 36 degrees. You click OK, and I'm going to select number 7, temporal scanner as my route. You click OK, and your heart rate, I'm going to put in 90. You click OK, and on the systolic BP, I'm going to put in 125. You click OK. And your diastolic BP would be 80, then you click OK. And now it's asking you for your blood pressure location, so I'm going to put in left arm, then you click OK, and your blood pressure was taken when the patient was lying on the bed. I click number 1, then you click OK. So after you're done documenting all your vitals, what you do next is you click Keep. This will bring you to your accept button. It's very important that you click accept so that you don't lose the data that you just put in. Then after which you can check on your bedside numbers grid the vitals you just entered. So what you do is you refresh the button and then you launch the screen. And this is the vitals that we just put in just now. And now let's go back to the other screen. And on the left lower corner, this is your reassessment documentation. So let's open this up by clicking this arrow. And then you click OK. And it will bring you to your documentation assessment screen. And below the transaction line, you have 3 buttons, and you can select from these 3 to do your reassessment. And it says here on the first one, same as initial physical assessment. So you can click this if you have the same reassessment in 4 hours. But right now, I'm going to show you how to do manual documentation of your assessment. So first, I'm going to click Go To so I can get into the field that I want to document on. So I'm going to choose cardiovascular system. So on number 24, I click this field and I put in normal sinus rhythm. Then I click OK. And the next one will be the heart sounds. So I'm going to put in regular and then I click OK. And on my jugular veins, I'm going to put flat. And I have the head raised at 30 degrees. Then you click OK. And on the edema, I'll put down none noted. Then you click OK. And if you are to add some more, I'll continue editing. So with the pulses, I click pulses and I'll choose bilateral and normal. Then you click OK. And for your posterior tibial, I'll click bilateral, normal. Then you click OK. And on the radial, I'll click bilateral, normal. Then you click OK. And those are the only pulses I want to document on. So I click OK and click OK again. And there is your documentation for cardiovascular. And if you want to add information about pacemaker, I can put in patient does not have a pacemaker, and then I click OK. And then you click accept. So this is how you do your reassessment documentation, after which it will populate on your assessment grid. So let's refresh this, and let's make this screen bigger by clicking this arrow. And there's your documentation for your cardiovascular system. So the next tab I'm going to explain about is the CCU IV intake lines and tubes. So this is the tab right here. You just click it, and you have 3 screens here. The one on your left is where you do your IV intake documentation, and the one on your right will be a flow sheet, which will be populated after you put in your IV documentation. And the screen here on the bottom right is your lines and tubes grid or lines and tubes flow sheet. Now let's start our IV documentation. So I'm going to launch this screen by clicking this arrow, and then you click OK. And on your solution number 1, we can document your maintenance IV. So you click on solution number 1, and then document IV solution, and then you choose your maintenance IV. I'll pick half an S, and then I click OK, and I click OK again. Then I enter the rate, 100 cc's, and I click OK, and then I click OK again, and I click OK one more time. And if you are to document your drips, you go to med number 1. You document this medication by clicking this box, and on this medication I'm going to pick dopamine. Then you click OK, and then you're going to choose the concentration of the dopamine, which would be number 1. Then you click OK, and now it says your enter number of milligrams, so I'm going to enter 400 milligrams, and I click OK in 250 ml. Then you click OK, and the dose would be in mics per kilo per minute, so I click number 5. Then you click OK, and I have an order of 5 mics, so I click 5. Then you click OK, and then click OK, and then I'll put in my rate, 11 cc's. Then I click OK, and then you click keep, and if you notice, it says your data entered on solution number 1 and data entered on med number 1, so you need to accept this. And then it's going to populate to your IV intake flow sheet. So let's expand this screen, and this is how it's going to look like, your IV intake flow sheet. Now let me X this out, and let's go to these lines and tubes. Now it looks like there are already some data is entered on this, so let me open this up so you can see what's inside. Now let's click on this chest tube start. So let me click this, and let's process the event. and it will show us some information about the chest tube and who inserted it, and what the breath sounds are at that time, and if there's a clamp at bedside. So those are the information you can see when you click on the chest tube. Now let me X this out, and let's get out of this screen. So let me close this. So those are the two tabs that are very important for the ICU, and you will only see these two tabs when you go work for critical care. Now for the CCU output, you are going to document it on the intake and output application here in Patient Shortcut. And to document, you can just click OK, and these are the categories for your output. And what you do is you just click on the urine output, and if the patient is voiding, you just click voided, and then you put in the amount of urine, 100 cc's, and then you click OK. And I'm going to document that the patient is continent, has a yellow urine, and it's clear, and then you click OK. And then you click OK again, and I click keep and accept. Now to display your hourly intake and output for the unit, you click this arrow down and you click hourly intake and output. And if you remember, on the IVs, we've put in 100 cc's of half an S, and the dopamine was running at 11 cc's. So now we have a total of 111 cc's of intake. And on the urine output, we have documented that the patient had 100 cc's of urine, and it shows here your balance, which is computed for us by the ARCIS system. And that ends my instruction on the navigation of the bedside numbers and the CCU IV intake lines.